Hello, this is Rosewater. Today we're going to talk about Lucy. Lucy left a comment on my comment section under one of my Lucy videos. Pretty much saying that, well, read it for yourself. It's under the Lucy video. It's quite long, but... So I did read it. And... what I can see in this letter is Lucy has a lot of talent. She really does. She is a nurse, we know that. I believe she's a nurse. But her scope of nursing is just, to me, is astonishing. If you want to take in what Lucy has said so far about her nursing, I realize it's 30 years, but I know a lot of nurses that did 30 years. I know a lot of nurses that did 40 years. So, according to Lucy and this letter that she left on my page, she has been a palliative care nurse, which is a specialty unto itself. They are wonderful women. They make your family feel like you're at home. The death process is very relaxed. There's no pain. They make sure the patients are not in any pain. They work very well together. They're gentle people. And that's what you have to be when you're a palliative nurse. It's a profession, being a palliative nurse unto itself. So, you have... So, Lucy, you're a palliative nurse, okay? According to you. You were also, must have been in labor and delivery because you had taken care of fetal alcohol babies. So were you a labor delivery nurse, or were you in the NICU when the babies were withdrawing from drugs or alcohol? That's two different specialties. Or you're so special that you could do both. I'm not sure on that one. And then you also mentioned that you took care of autism children, kids with autism, kids with eating disorders, kids, a whole range of kids. So not only were you in labor delivery and or NICU, you were also on the pediatric floor, because that's where the sick kids go. Pediatrics takes care of a wide range of special needs children that come in with autism, but only in injuries. They don't assess them. That's not what a hospital nurse does. They take care of if they get hurt, as any child would get hurt. Because if you're taking care of a child with autism, that's another specialty. You also mentioned that you could have been on the phones for a suicidal hotline. A lot of nurses do that. I commend you for that. But to be on 24-hour care of a suicidal patient, you would have to be working in the mental health field. And that's another specialty of nursing. So do you have that specialty of nursing too? You're a mental health nurse? There's different stages of nursing. There's different facets. Like they don't... One nurse does not mean you can... Because you're a nurse does not mean you can do everything. They're all specialized. They all have a specialty. Orthopedics, that's another specialty. Did you have anything to do with broken bones or the care of people with broken bones? Like, that's another specialty. Burn unit, did you work on the burn unit? Like, that's another specialty. Neurology, you said you took care of strokes, people with strokes. Now, did you take care of the people when they had the stroke? So you worked on the neurology unit? Or were you taking care of a stroke patient when they started their rehabilitation? So were you on that aspect of it? Because that's another specialty. So for your 30 years of nursing, you've had palliative care, cardiac care, and cardiac care, that's... Now, was it a step-down unit? Or was it, critical care unit? Some of them just came back from an operation and literally they're come back with pipes and tubes and it's not a pretty sight. So were you in that? Because they step down from that room. They, you know, they go down to the general population. Like they start off in ICU and then they just kind of go backwards from that. Were you in that kind of unit? That's very stressful. Cardiac floors are very stressful. So if you're a cardiac nurse, how about oncology? You mentioned something about oncology and cancer patients. So you were in oncology. You were on the oncology unit, which would make you a nurse, oncology nurse. Now they specialize. They have their own specialty onto themselves when they work on the oncology floor. They have nurses that work with radiation. They have nurses that only take bloods. They have nurses that take care of each individual aspect of nursing. Not one nurse does everything. It's divided into sections. So I can't see, Lucy, how you fit all these specialties into your 30 years of nursing. You were either a super nurse. Oh, and you mentioned the ER. That's another nursing specialty. Working in the ER. Like most people that work in the ER because they love the adrenaline rush. They love the excitement of the ER. They know a little bit about everything because that's what you have to know when you're working in the ER. So if you worked in the ER and you've worked in palliative and you worked with fetal alcohol babies, I'm assuming it's a NICU. If it's not a NICU, it's PEDS. And doesn't matter which one, that's another whole profession. And then you also did flu shots. Flu shots. Now I'm not quite sure how that one works out because the flu shots that I've seen, like flu shot clinics, the ones that I've seen are, if it's inside the hospital, I'm not sure where they get all the nurses from, but they bring a bunch of nurses in, they set up a station, and you line up and you get your flu shot. Simple as that. If it's when the swine flu came through, I'm not sure if it was provincial nursing or who set up, or if infectious disease. Or do you work for the infectious disease control too? Are you a nurse for infectious disease? Like, you were giving out flu shots, so I'm not really sure, but I'm pretty sure the private nursing, not private, but the provincial nursing association somehow, because it was province-wide, everybody across Canada got a swine flu shot. It was free. They opened up gymnasiums and had nurses, and you just showed up and got your shot. I'm not really sure where they pulled the nurses from. Could have been from VONs. Not really sure on that. So you were involved in mass inoculations. Inoculation would be the same as flu shot. Like, that's a specialty unto itself too. Some nurses, all they do all day is take bloods. Like, that's their job. Some people, all they do is go flush lines. That's all their job. That's all their job is. Like, if you have a PICC line, they go and they flush.